there. Make yourself comfortable. Could you just confirm your name for me? Okay, that's perfect. How are you feeling today? Okay, that's understandable to be nervous. Alright, well, my name's Surgeon Sarah, and I'll be performing your lymph node biopsy today. Okay. Now, I know you're going to be worried, okay, but the reason that you're here today is for me to take some samples from a lymph node on each side of your neck, those ones that you've felt as sore lumps for a while, okay? Now, I believe that you get repeated ear infections, alright. Now, these lymph nodes could be a result of those infections, that your body's working really, really hard to constantly fight something off. Now, you shouldn't have constant infections, and I know that that's being looked at, okay, by your ENT specialist. Alright, but they just wanted me to do the biopsy today to take a look at those little lymph nodes. Okay, yeah. Alright. No, it doesn't mean there's anything sinister going on, but we just need to see what's happening in those lymph nodes. Okay. Now, I've been told that the lymph nodes are palpable. That means I could feel them. So if that's the case, I won't need to use any sort of imaging like ultrasound to guide me to the lymph node. Alright, so what I'm going to do at first, I'm going to pop some gloves on, my lovely. I'm going to have a little feel around your neck, around the back of your head, across your shoulders, and I'm going to have a close feel and a close look at those lumps, alright? It may be a little bit uncomfortable, okay, but I will numb you up before I start the biopsy. I'll also take a look down your ears as well, okay? You happy with that? Good, alright. Let me just pop some gloves on. And my nurse has taken your temperature, so we know that your temperature actually is okay. So your infection may just be in a little bit of remission for now, but we need to get to the bottom of that, which is what the ENT doctor is doing. Okay. But for now, I'm just going to concentrate on getting these lymph nodes biopsied for you. Alright, so keep yourself nice and still there for me, my lovely. I'm just going to have a little feel around, okay? Right. Just around the back of your head. Okay, just coming forward now. And just down your neck. Okay, so I can feel those swollen nodes, okay. They're not all swollen, there just seems to be a couple, one on each side, matching pair. Okay. I'm just going to go along the shoulder area there, for your supraclavicular lymph nodes. Okay. So like I said, I can feel those couple of bumps there. Alright, so I'm just going to pop around the side and have a real close feel round, okay? It will feel a little bit tender for you, I'm sure, but if you can just keep nice and still for me. Alright, I'll be very gentle. Alright, I'll start with this side. Okay. Alright, so I'm just going to have a feel around, and just around the ear area too. Just a close look at this bumpy lymph node. this side now. Is that okay for you? Yeah, it would feel a little bit sore because it is rather swollen. Yeah, I can still only feel that one though. Alright. Okay, and same again here. Okay, just feeling around that node and around the ear. So I'm going to take a little look inside your ear now, alright. Okay, I'm going to use this otoscope here, okay. It has a light inside and it just enables me to look down your ear canal. I just want to check to see how things are looking down there. Alright, okay. I will need to just pull very gently up and back to get the ear canal in the correct position. Alright, okay. We'll start with this side, shall we again? Just pulling up and back and then in we go. There we go, well done. So I can see that your ear canal is still swollen, looking red, and the ear drum, that tympanic membrane, looks like there's still fluid behind, so there's still something going on there. Okay, just reposition a little bit there. Okay, I'll withdraw that now because that's painful, I can tell. Well done. I'll check your right ear. Okay. Just again. Gently pulling up and back. And inserting that now. Okay, I can still see this inflammation in this side too. Again, the eardrum is looking really bulgy, lots of fluid there. Okay, let me withdraw. Alright. You just relax there a second. I'll just update this. Okay. So I'm going to inject a little bit of local anaesthesia just into the area around the node, okay, on each side. That'll work quite quickly, alright, but first I'm going to have a little wipe around the area, alright. Some special wipes here. Okay. Alright, let's get one of those. And have a little wipe around just down your neck where that node is and the surrounding area. So now the area is clean, I'm going to inject a little bit of local anaesthesia around the area. You'll feel a little pinch and a burn at first, and it'll go numb very, very quickly. Okay? Right, so let's just get my syringe ready there. Okay. I'm going to be using lidocaine. And it numbs up very, very quickly indeed. Okay, let's just draw some of that up. There we go. Maybe a little bit more in there. Okay. Right. I've checked your notes and you're not allergic to lidocaine, so we'll be okay there. Alright. Okay. So I'll give the area a little pinch as I'm doing it, because that helps to distract from the initial burn, alright, as I put it in, but it will only last for a very short time, the discomfort. Okay? Alright? Here we go then. Alright, so you keep very, very still for me, my lovely. And I've got some tissue here to wipe up any little bits of drips of the raw. Right, sharp scratch coming now, okay? Okay, a little bit more. Okay. There. Wonderful. So that's that side done, alright? Okay. And now this side. So again, sharp scratches, I just inject the area around that lymph node. Okay. Here we go. Alright. Perfect. We'll let that take effect for a moment. Just get the patch off that lidocaine. Okay, perfect. Right, I'm just going to test the areas now, alright, just to make sure you're numb. Okay, can you feel this? Okay, can you feel anything now? No? Alright, that's nice and numb. And can you feel this? No? Anything here? No, okay. That's all good. Right. So what I'm going to do now is I'm going to be taking hold of the lumpy area, and I'm going to be using this needle here, and I'm going to take a little sample of the lymph node away. Alright? No, you shouldn't feel a thing. If you do feel anything, just pop up your hand and I'll stop, and I can always inject you with a little bit more lidocaine. Okay? And then what I extract will go into a special pot, and that will go away to be analysed to see what's going on with that lymph node. Alright? Or lymph nodes. Yeah. Are you ready? Okay. You're doing very, very well. I know it's a nerve-wracking experience, but it shouldn't be painful at all. Alright. Okay, my lovely. So, I'm just going to go in now. I'm going to withdraw a little tiny bit of that lymph node on your neck, okay? Here we go. You might feel some pressure, my lovely, but you shouldn't feel any pain, okay? just going to pop you a little dressing on that, alright? You can keep the dressing on for a couple of days. Try not to get it wet, okay? They're just very soft, square dressings, okay? Let's grab my scissors. Just give that a little dab with some gauze, alright, before I do it. Okay, get some gauze there. Okay, so I'm just going to give the area a little dab, just with this before I put that dressing on. A little bit of lidocaine running out there, and it minimal bleeding from that area, but I just want to give it a little dab around. Okay. There we go. So let's get you a dressing on. Nice and comfortable. I'm going to fix it with some tape, okay? Lovely. Put that on there. Just make sure that that's all stuck down. Okay. Lovely. Perfect. You okay there? Good. Right, let's get another dressing. These can be difficult to open. Okay, get that ready there. Okay. Right. So same again on this side, my lovely. I'm just going to extract a little bit from that lymph node. Okay. Keep nice and still for me. Here we go. Remember, pop up your hand if anything feels sore. Just a little pressure. Okay, all done. I'm just going to give it a little dab round. That's fine. Okay. I'm going to pop you a dressing on. Alright. Make you nice and comfy again. Okay. Just going to press that dressing out of there. Lovely. And some tape. Okay. A bit more. Perfect. Let's get that. Make sure that's in the right place. That's it. Let's get that Well done. Okay. So the dressing, as I said, can stay on for a couple of days. If you notice anything unusual, like there's a lot of pain, swelling, or any pus you can see coming through the dressing, please come straight back. Okay, but it should be fine. I don't really want to prescribe you any antibiotics at this point because I don't think there is going to be any infection, and you've had a lot of antibiotics recently, haven't you, with your ear problems? Yeah, okay. So the biopsy samples will take about a week, okay, to get tested and the results to come back. They'll come back to me, but they'll also come back to your doctor as well, who referred you. All right. I'll also make sure that your ear, nose and throat consultant has the results as well, so they can see what's going on as well, and we'll take it from there. But I know it's very difficult, but try not to worry, my lovely. All right. Okay, because very commonly, if you've got problems with infections, like I said, these lymph nodes could stay swollen for a long time, but we need to just double check to make sure there's nothing else going on. I know you've had a lot of blood tests as well, haven't you? Yeah. Okay. All right. Well, you haven't got to go home straight away. If you go outside, my nurse will take care of you and she'll sit you down and give you some nice tea and biscuits. All right. You've been very, very brave because I know you were very, very nervous. Yeah. Okay, my lovely. All right. Well, when you're ready, you get yourself out there and nurse will take care of you. I'll just update your notes now. All right. Okay. See you soon. Take care. Bye.